It's Monday, July 12th, 2021. My name is Jonathan Lau, and this is 5 Minutes of Proof, a weekly analysis of the science behind ozone therapy. Today, we're going to take a look at a case report. This case report comes to us from Brazil. Here's the title: Topical Ozone Therapy in the Treatment of Pharmacodermia in a Dog. So what is this, you might actually ask, and we'll get to that in a second. Pharmacodermia, that is. But they say wound cleaning and debridement were performed, and it had been recommended to suspend the previous treatment. Previous treatment was antibiotics with some topical ointments, and things just weren't working out. And prescribed the use of ozonated sunflower oil and ozonated saline. Okay, so that was what they decided to go with. So pharmacodermia, for those who are wondering, is an adverse drug reaction which is manifested in the skin and mucous membranes, and you'll see how it was manifested, at least in this patient, in this case. So here's the backstory, just really quickly. The patient had gone into surgery, had been sewed up, everything went well, was sent home to recover, and developed some sores and developed some wounds on its back. So they came back in, and they decided to go ahead and treat. We're on the right-hand side of this highlighted area, using some topicals and some ointments for 5 to 10 days, depending on the particular ointment they were administering. After 5 days, though, after beginning of the second treatment, the owner reported no improvement, and in fact, the increase of size for those lesions. So they were growing. And so at that point, that's when they recommended, hey, let's stop this and let's start using ozonated oil and ozonated saline. You can see here on the right-hand side, this picture, just a nasty, nasty wound that had developed, some necrosis and some purulent infections, and it was just not looking good. So they decided to go with option number 2, which should have been option number 1. And oftentimes that's the case. So here's how they started. After the third day of treatment was observed, the presence of granulation tissue and epithelial tissue was noted. So after 3 days, this is after debridement here on the right-hand side. After 3 days, this is what you're seeing. And this is with ozonated oil and ozonated saline. Just a phenomenal healing pattern here. You're seeing granulation, you're seeing a closing of all of those open wounds, and just a healing process that looks exactly like it should. The owner reported absence of pain during palpation while the treatment was performed. 30 days after the treatment with ozonated sunflower oil, there was complete remission of the wounds. Let's look at figure 4. Bear with me here as I scroll down. Here we go. 30 days later, wow, that looks fabulous comparatively. You have closed wounds, you have tissue that's just looking good and healthy, you have skin that's looking healthy, you have hair that's regrowing, so everything is pointed in the right direction. And then finally, 5 months after the treatment, the dog returned and no wounds were observed. So here you go, 5 months later, in the end. So that was just a really cool case report. The efficacy of ozonated sunflower seed oil used to treat wounds in this case report was corroborated with other information that's available to us in human studies and also in other animal studies. So this isn't the only time this has happened. In fact, I have a number of veterinarians who use these treatments with ozone oil and ozonated saline and see some wonderful results. According to the present case report, the use of ozone therapy using the ozonized sunflower oil and saline solution is effective to treat wounds related to pharmacodermia. We hope this has been helpful for you. Thank you for being with us. We'll see you next week with another installment of 5 Minutes of Proof.